So some examples here, I'm going to explain about the how to train the balance training. So these are the some different simple exercises we are going to improve the balance. So who are having the like a imbalance in the like a loss of the balance. So especially these including the first exercise is the standing exercise. The standing and the so weight on the one leg. So in the single leg standing. So in the single leg standing and also other legs I have to change the positions. So these single leg standings are is very important to maintain and also balance and to improve the balance in the especially in the elderly patients. So these are single leg standing exercise are especially we have to give the single leg stands and also the other leg is unsupported leg have to change in the different directions. So we have to ask them to maintain in the like a hip flexion positions and also hip abductions and also hip extension positions, ask them to change the positions. So these things in the last class, we discussed regarding the assessment of the coordinations. In the assessment of the coordination in the equilibrium test, so we give the different positions, single leg standing, tandem walk positions, and also in the tandem walk positions, we have to shift the weight to the right side, shift the weight to the left side, and also forward reaching postures, alternating the raise, have one hand upwards and also one hand forward. So these things also going to be the weight shifting. So it also help to improving the balance. So these things are we have to practice in the standing positions, and if the stable in the on the hard surface. So if they're stable in the hard surfaces, we have to change the positions of the surface, and also maybe we can give to the with different type of in the rubber mattress and also in the wooden mattress, and also if the patient is able to maintain the balance in the like a tiles floor. So after that, if it is a rubber mattress, so if they can maintain, so then we can give you the progression into the like a foam standing on the foams. So in the same single leg standings, but we have to change the position of the body. So one is going to be the forward leg positions and also side leg positions. And this one is going to be the single leg standing, the hip abduction, hip extension positions, and also knee flexion positions, and also hip and knee flexion positions. So all together, after the changing the surfaces, hard surface and soft surfaces and also foam surface, depends upon the patient's like a response. If the patient is getting the improvements, so then we have to change the surface of the like a standing surrounding surfaces. So it should be a hard surface and also soft surface, foam surface. So it's in the mattress surface. So we have to use. After that, and also we are going to use some standing in single legs, we have to carry the weights. So with the weights also, we have to change them into the positions and also twisting activities, how they are going to maintain the balance. So these things are going to be increasing the strength in the postures and also in the muscles, so somatosensory systems. So this helps to improving the balance. And also another one is going to be is the So another is going to be increasing the changing the position of the limbs. So especially for the feet, we have to do maintain the like a tandem positionings. So tandem position means ask them to stand on the straight line. So if they maintain the straight lines, the base of support is going to be decreased. So always should be we have to concentrate on the base of support and line of the gravity. So if we reduce the base of the support, so normal person they can maintain at least they can maintain who are having the stability in the body, they can maintain the balance. But in the elderly and also who are having is a loss of the motor function and also sensory functions, especially who are having the cerebellar injury, they may not maintain the balance, so they may chance to get the falls. So here, so what test we use to assess the balance in the coordinations in the cerebellar injury patients. So same things, same exercise we are going to give to improve the balance in the tandem walk positionings. And also next one is we have to ask them to maintain the standing up and also sitting down from the chair without using the hands. So these things we have to ask them to, from the standing positions, ask them to sit on the chair without support. And also from the next one is we can, if they get the progressions from the sitting positions, ask them to stand up without using the hand support. So depends upon the like a patient's like a control the strength in the trunk. So we have to modify the how to stand up from the sitting to the standing or standing to the sittings. So these things are sometimes with we can, if they get the progressions, we can ask them to stand on the single leg and sit on the chair and also stand up from the chair. But this one is going to be need more effort, and also who are going to be like in the challenging one, they only can sit in the with a single leg standing and a single leg sitting and also single leg standing. So these are the highest like a progressive exercise in the balance. So, and also we can ask them to do some like in the walking patterns or maybe in the exercise patterns, ask them to do the high knee positions while walking and while walking and also while step up also. So we can ask them to do the high knee positionings or high knee alteration of the positions, also going to be increasing the balance and also increasing the strength in the trunk as well as in the flex proximal muscles of the hip. So this also helpful to maintain the balance in the different type of the these different type of the exercise are going to be helpful to improve the balance. So these are some examples of the balance training. And also another equipment, so especially these equipments is going to be the bosu, or maybe is this equipment like a Swiss ball, nothing but is the ball. So it's going to be gym ball, but it's going to be the half. So that means it's going to be like a wobble board. How we are going to use the boards or the board platforms to improve our balance. So this boards are is the balance board are going to be improve the strength in the lower muscles and also improve the balance. So it should be is appropriate. So we can ask them to stand on the both or maybe is the balance board. So with a single leg, so if they are able to balance, one leg should be on the ground and one leg should be on the balance board. So in the same thing, we can ask them to do the different positions. So if you see here, so one limb on the ground and one limb on the both board or is the balance board. So here we can ask them to do some squats. So who can able to maintain the balance? So because of the one leg in the ball, so it's going to be the wobbly or is going to give the shivering. So who are having the weakness in the like a somatosensory system or especially muscles and also ligaments. So who are having the ligament injuries also, sometimes we have to train properly. This training is going to increase the proprioceptions. So because of the increasing the proprioceptions, so automatically it also will fully improving the balance. So single leg the standing on the like this balance board, or after they get the progressions, we can ask them to stand on this balance board with the both hands. Sorry, the both legs. So ask them to do, if they stand in the with the both legs stand on this balance board, then we can we can give the variation of positions. So ask them to do some squatting on this balancing board, and also single leg standing and variation of the other limb, the non-weight bearing of the limbs, or maybe we can do the flexion of the opposite limb and extension of the like a knee hip extension. Other leg stand on the one leg, and also whatever the we exercise we gave here, the same exercise we can train here on the both also. So that means depends upon the progressions. If they getting the progressions, so this the simple exercise, all the single leg activities we can train on this balance board. So if the person is able to do the single leg standing and also double leg standing and also variation of the limbs positions, so if they're maintaining the positions, then we can give some progression exercise. So we have to give some weights, and also we are going to ask them to do the changing the body positions with the weights. So ask them to maintain the body positions. So these positions are going to be helpful to improve the core muscles, as well as is also going to be improve the like a balance strength. So these exercise, the advanced training, who can able to do the single leg standing and the like a balance board, double leg, and also we can do the whatever all the single leg standing. So everything is we have to train. So step by step, if they reach to the like advanced stage, in the advanced stage, we have to do in the like a weight bearing and weight shifting, and also with the carrying the like a it's a medicine ball. So these medicine balls we have to try to give the like the sideways and upwards and downwards. So changing the body positions to maintain the balance, it will be possible in the advanced condition of the balance training. So if anybody have reached to these positions, so we are going to be completely, that means prevent the falls, and also we can improve the balance. And also not only for the standing positions, we can give the this some strengthening exercise, balancing exercise for the upper limbs as well as for the trunk also. So if you want to improve the proximal, like in the shoulders and the elbow and wrist, so and also core muscle strengthening, also we can do the like a plank positions. So these plank positions, if we put the hands over the bosu or balance board, so it's also going to maintain the plank positions. So this position is going to be helpful to improve the core strength as well as it improve the strength in the proximal muscles of the glenohumeral joints and also elbow joints. So this also important training to improve the balance. And also lunge positions. So this lunge positions also is going to give the strength, proprioception to the right leg and also stretching to the left leg. So these trainings are going to be single leg standing and also sitting on the standing on the is a bosu or maybe is going to be the balance boards also going to be helpful to improve the balance in the who are having the loss of balance. So next one is the important training, the balance training is the perturbation balance training. So perturbation based balance training. So here in the last class, we discussed about the what is the perturbations. So perturbations means if the patient is the standing, so with patient conscious, unconscious, if the patient is not aware of the pushing, so that time if we push, if the patient is able to maintain the balance, so that means their balance, the perturbation is the normal. So is the form of the training that aims to improve the reactive balance control after the unexpected external perturbations. If we push unexpectedly to the patients, if the patients maintain the balance, so that balance is called as the perturbation balance. So if they lost the balance, so that means they're having the loss of the balance control. So the reactive balance is going to be is altered. So this is mainly especially who are having the cerebellar injury may chance to get the history of the fall. So for example, normally we can see some play toys also while the playing kids playing. Do you know the like a the penguin type of the toys, the way bottom is going to be the heavy. If we push forward, so automatically the penguin is going to move forward and comes to the back side. So one type of the toy, like a balloon type of the toys. So that is one example for the perturbations. So normally it's the same like if you push the person, the baby, the patient, so who are high, who are going to be like maintain the balance to come back to the neutral position means, so they are maintaining the balance and also, so there is no abnormality in the balance, especially for the who are having the cerebellar injuries. And also it is an intervention involving in the repeated postural perturbations, aiming to the improve the control and rapid balance reactions. So especially who are having the balance problems, so this perturbation based training is going to be helpful to improve the balance who are having the like a rapid balance reactions or abnormal rapid balance reactions. So in the perturbation-based balance training, so this perturbation-based balance training is divided into the three important trainings. So that is the double leg foam balance activity and also tilt board balance activity. And next one is we are going to do the like a roller board and platform perturbations. So these three type of the activities are important in the perturbation-based balance training. So first one is going to be the double leg foam balance training activities. So in the double leg foam balance activities, just now we discussed about the single leg standing positions. So if we are getting the progression from the patients, we have to modify the like a single leg positions. So in the single leg positions and also changing the ball like a other limb positions, flexion, abduction and extension and also lunge positions. Or maybe we are going to do the like a foams like a rubber foam, or maybe we are going to be the like a one layer foam, two layer foam, three layer foam. So these things are going to be the progressions. So that's going to be improves the balance. So depends upon the foam layers. So here we have to do the subject stand on the foam surface, a soft foam surface with the both feet on the grounds. So here and also the therapist attempt to perturbate the patient's balance in the random fashions. So that means if, for example, if they're standing on the foam surface, is it maybe foam, maybe rubber foam, or maybe in case of the any mattress, so ask them to stand or any mat. So if we give the therapist have to give the random perturbations. So if they push, so they have to maintain the balance. So this type of the like a double leg foam activities. So these things have to do like in the in front of or in the supervision of the therapist. So if they any may chance to get the fall down, so this type of exercise are improve their balance and also improves the coordinations. So how to give this exercise doses and progressions? The duration of the activity is approximately 30 seconds. So we have to ask them to hold the positions, and also we try to give the perturbations. We try to push forward, or maybe if we have to try to from the push forward with the posteriorly, or from the anteriorly if we push forward to the posteriorly, or side to side to the left side as well as right side, how to push. So how they are going to control the balance, how they are going to react to our like a push or pull. And also this the difficulty is the progress as the subject improves by the progressing to the ball catching with a therapist perturbating subject balance while standing on the foam, and also progressing the single leg support if tolerated without knee pain or swelling or buckling. So if we the foam standings, the therapist have to modify the activities. So in the foam standing also have to give the some the ball activities, high hand skills, that is the some coordination skills. So if we throw the ball, the patient has to catch the ball, and also he has to throw the ball. So this type of activities are going to be improve the balance, and also is also increasing the coordinations, and also single leg support. So single leg support, if they maintain the single leg support, if we get the balance, so we can ask them to stand on the single leg. So with the single leg, so without any pain or swelling or buckling, so it indicating the progression is getting better. So these type of activities are going to be helpful to improve the strength and also balance who are having like a loss of balance. So coming to the next one is the another type of the training. So especially these are going to be called as the tilt board balance training. So different type of the boards are available in the market to strengthen the balance. So we can use the wobble boards and tilting boards or Bosu or this type. So many different type of the boards are available to improve the balance. So here we have to give the these balance boards are going to be helpful to improve the balance. So here the therapist perturbate the tilt board in the forward, backward, and also side to side directions approximately 30 seconds for each. So after reaching so who can able to maintain the balance in the double leg forms strengthening. So in the progression, so we are going to give the a tilt table. So after the completing the progression in the double leg support, then we can come to the single leg support. So if they maintain the single leg support on the foam, single layer foam, double layer foam, and triple layer foams, so depends upon the progressions. Again, we can give the another type of exercises. So these are going to be the tilt table or maybe the wobble board table boards. So these boards are helpful to maintain the a balance and also improve the balance. So if the patient is able to stand on these boards, so the therapist has to give the a push or pull through from the front or back, anteriorly and posteriorly, and side to side, right side and left side, at least 30 seconds have to maintain. So these exercises are going to be improve the balance and also improve the coordinations. And also coming to the how we are going to give the exercise doses in these tilt board trainings. So and how we can give the progressions. So the difficulty of the activity is progressed by adding the ball catching during the perturbations and progressing to the single lip support perturbations if the subject tolerates the single lip weight bearing without the knee pain and swelling and buckling. Same thing they have to how they are standing in the a foam and how we change the progression. Here also in the same boards, if you see here, they have to stand the normal standing. So after normal standing on the board, so without fall down, at least 30 seconds, they have to maintain the balance. So after this normal standing, so ask them to squat and the squat. So after squat, have to do the lunge positions. So anterior lunge and also posterior lunge and also side lunges. So and also we have to give for the next we can give to the plank pose. So this plank pose are going to be we have to be the change the position of the hands. So all these changes, so from the side to side and also front and back, you can see the changes of the position of the hands. So these things have to give, and also for the plank positions, hand on over the board and also legs on the board. So we have to change different positions are going to give the different muscle actions. It is going to increasing the core muscles. It will help to increasing the balance. So coming to the another like a training here is going to be the roller board is going roller board platform perturbations. So these roller board platform perturbations are this is going to be the progression to the previous what we discussed in the about the like a tilting table. So this is going to tilt board balance training. So this is going to be roller board. So that means one leg is going to be in the roller board and other leg should be on the like a static board. So it is on both should be maintained, and also the therapist has to give the perturbations in all the direction, anterior directions, posterior directions, and also right side and left side. So the therapist perturbate rollers board in the multiple directions at random. The subject attempt to resist the perturbations. So the activity lasts approximately 30 seconds. At least 30 seconds have to maintain. So these are going to be improves the core strength and also improve the balance. So this activity is repeated by changing the limbs on the platform and also roller boards. So here, if you see here the roller board is going to, the first one is going to be maintain the single leg stance. So after that, they have to change the limb positions. After that, so here is going to maintain the like a stable board and also non-stable board. So that time the doctor or maybe is the rehabilitation therapist or physiotherapist have to give the like a perturbations. So according to the push or pull, the patient has to maintain the balance. So this also how to give the same like how we are going to the progressions, how to give all the progressions. So without swelling and without changing the pains, and also these things have to change in the positions. So the activity may begin with the subject in the semi-seated positions. So initially with the sitting position, semi-seated positions, if they get the progressions, so we can bring them to the completely standing on these roller board platforms. So then only we can improve the strength and also balance in especially for the hip muscles. So the activities progress to the full standing positions when the subject is able to tolerate these positions without pain. So if the patient is able to maintain the standing positions without pain and without buckling and without swelling, so this is going to be the complete the progressions. So then it means so the patient getting the exact improvement with the roller board platform perturbations. So these three types of the perturbations are very important to enhance the balance and also coordinations.